Hi, I am going to be going over a question that I had from one of the followers or maybe a visitor. I can't recall right now. My name is Dr. Mkono, and this particular question was, why is some of the inhalers, I think specifically this one, is causing her to cough? Um, this is very common that people have a coughing fit even prior to the diagnosis of asthma. So we would need to figure out whether they're actually diagnosed with asthma or not. And I don't have those details. And by no means am I saying that when I'm on here answering or responding to people that I'm trying to be the doctor or the pulmonologist. I'm basically trying to be a resource for people to check basic things, and then they should run back to their providers and ask them the same question, because the providers should be giving you this information. But I'm glad that they asked, because it is a very interesting question. If you have inhalers, whether they're made like this or they are like these over here, um, they all have different ways that they distribute the medication. They might even have the same medication or similar medication, but they're distributing it in a different texture. The powdered ones, they tend to cause more of the coughing, or what I see my patients complain of as coughing. But what we need to do first, and that's what I would advise her to do first, is to first make sure that she's not coughing from the inhaler itself, but first to check whether there's coughing related to having asthma or COPD. So if your baseline is that you have asthma and you have COPD and you start coughing, and then the doctors prescribe you one of these inhalers, they would want to make sure that your coughing has been addressed, that there isn't anything acute going on with you, meaning there isn't anything ongoing, like a infection maybe, or you could have uh, had a pneumonia recently and you're recovering from that, maybe allergies. Post-nasal drip is a big one. Many people have post-nasal drip. Welcome for those people who are visiting. I am presuming as I begin this journey, most of the times I'm going to be talking to myself, which is totally fine with me. I do quite a bit of that lately as I go through teaching majority of you guys on my social media accounts and in my office. But for this is that you're coming in the middle of a conversation, and I want to make sure that you may not have a chance to go back. I appreciate all you guys. I see 15 people looking right now. My name is Dr. Mkono, and I'm trying to simplify, make it so that you can relate to your illnesses and get better care, advocating for yourself. So we are now discussing a person who has asked me a question about when these inhalers are causing coughing, if they're coughing because of the inhaler or is it something else, basically, is what I would assume they're asking me. Before we blame these inhalers, I was saying that we need to make sure that the underlying process, which is asthma, COPD, if it has been diagnosed already, because sometimes we do put you on these while we're working up asthma or COPD, and many other illnesses cause cough. Just remember that the lungs only speak one way. They breathe heavy, they have tightness, they have cough, they have production of phlegm. There's so many ways that the lungs will be communicating to you that there's something wrong, right? So then sometimes we've already figured out what's going on with you and we've diagnosed you with asthma or COPD. And then we give you these devices. And I was saying to you that some of these are made with powder form. And it's a powder that can be a little irritating for some people, especially if they don't know how to take their inhalers properly. And some are made so that they give not a powder, but they give a mist. And so I sprayed this one and I said, you see this one? It's really, even when I sprayed here, it's got liquid, right? It's like almost liquidy. You would think that it's less irritative, right? And for those people who have inhalers such as these, These can have powder. This one doesn't have any powder in it, but there are so many that I would be able to tell you that they have powder inside, right? This one is Wixella. See? See? So this fine powder, for some people, they can't handle that. And that could be the reason that they can cough. But before you blame any inhalers, you want to seek care with your provider, and you want to make sure that they themselves have confirmed that you, one, have been taken care of. If you have asthma and you have a flare up differentiated from an attack, you could be coughing for because you have an attack. You're going to be coughing, and this is not the time when you're having an attack to start sorting out your inhalers. Inhalers come way before that. But let's say you have a flare up, you would be coughing also. You may be wheezing, you may be tight, and you or recovering from pneumonia. What would you be doing? You'll be coughing also. So I don't want to make any assumptions of this question other than say that it was definitely a great question where I thought it will start this conversation with you and tell you that the first thing is to go see that provider, let them know you're coughing, and you want to go back and complete that loop in letting them know that I took the inhaler as prescribed, because a lot of you guys, when we give you these inhalers, you make the as needed become the routine, which it shouldn't be, and then you make the routine one become as needed, and they don't work like that. They really work with consecutive application. They get better, as you use it consecutively for those maintenance. So since this is a maintenance device, I want to let that person know that, number one, go back to that provider, because I'm not providing any medical help, but I'm just trying to tell you, educational wise, check that one is a powdered one. See if they can switch you to like a mist one. And then when these come along, you need to make sure that you know how to use them. And if you do not know how to use these, you'll be wasting them. So they're a little bit more challenging to grasp for many people. And make sure they put a spacer if you need one, because we, at the end of the day, want you to get the medication. It's not just switching devices. And then it's not just putting it away and say, well, it's making me cough, put it away. Because then you end up hospitalized, you have a bronchitis, you have a admission, somebody throws antibiotics to you, now they're giving it to you through the vein, which is like really supposed to be reserved for when we're having an acute episode. We're sick and we definitely need something to rescue us from this attack or flare up. We give you the pills and the IV so that you can get an immediate response. It's not meant for you to keep using it every 3 months over and over again, pills, IV, hospitalization. So the reason we are using these inhalers is because it's distributing it into your lungs safer. It's going to go into your lungs. But some people, powder versus mist, it is a fine testing out which one works out for your dog, for your patient better. I would tell you that you should go back and check with that provider and say, hey, this is making me cough. Is it the cough from the inhaler, or is it a cough from me not being settled with my asthma or my COPD? Because if you have asthma or COPD, sometimes we've got to give you the pill steroids to settle you. Maybe you're way up here, coughing, hacking, tight, bouncing in and out the ER, or you're over here. Maintenance are over here. So we bring you down with that steroid and pill, salumedrol, prednisone. We bring you down. And once we bring you down, we expect you to then hold yourself down here with these inhalers, because that lung is irritated and it needs something every day. And you know already, I've already explained to you, consider these inhalers like a little lotion, right? You cannot expect these little mild medications, I'm not saying they're not going to have side effects, to work when you don't use them right. You've got to schedule them, fix them. If you want them to work for you, you've got to mix some of these things that I'm saying and say, listen, I need to fix the situation, because if I don't fix it, I'm going to end up in the ER. For those people who have gone to the ER many times, seen their pulmonologist many times, they know them, their first name, last name, they meet each other almost like a social event. It shouldn't be like that. I want you to know that we're supposed to meet you, settle you down, and majority of you should be going and seeing us once a year. And if you're ending up seeing your doctor every year, once a year for refill of medications and everything is good, we start looking for the lowest possible dose to control you. So when somebody says, I'm having a cough from an inhaler, I want to differentiate. Is it from the inhaler or is it from the asthma kicking up? What do? They will do a breathing test on you. But what I would say before they do that is this: ask that doctor, do I have postnasal drip? Because that's a very common one. The drip, the drip, 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 drip. It tickles the back of your throat and you cough. And guess what? When you actually go and do something like this, without coughing, for some of you, you're just already, you're coughing all the time. When you do this, you're gonna, and you cough it up. It's not gonna work. We need to hold this medication inside your lungs. Your lungs need to be settled. This is why when you get hospitalized most of the time, we sit you to a nebulizer. Have you ever wondered why? That's because your lungs are already really irritated to the point where you're coughing, you're hacking, they're irritated. We have to give you nebulizer, which is also a mist form. So am I saying you need to switch to a mist form? I'm going through this because I want to make sure we kind of cover all the ground. You're coughing, make sure they did a chest x-ray if you're not pregnant and you're not young, where they don't need to do an x-ray on you. I'm talking usually to adult patients, so I want to make sure you understand. Get that chest x-ray for sure. Make sure they treat you if you have an asthma exacerbation or a flare-up or a COPD exacerbation, that they give you the steroid pills because they need to settle you before they start assuming these little things can help you. Yes, they may, but you need to know these work over 2 weeks, sometimes a month after you're using them as they are scheduled, right? If this is twice a day and you use it sporadically, the first dose is going to be 10, you did it, 10%. The next one, let's say 20. The next one, so AM, 10, 20, 30, 40, 50, 60, 70, 80, 90, 100. Now you're at 100. Few days later, right? And you are now at 100 effect of that dose. This one is 500, right? The doses vary. They can be low in here and they can be high. So let's say in a few days, few weeks, you're still not getting the full benefit from this. It's either you're not taking it right, your schedule is off, okay? Or there are other things that are kicking things up, or maybe you need a higher dose. That's when we go from the low dose to the high dose. But first, we need to fix whether you're using this medication right. And how do we use something like this correctly? Because you were worried. I'm coughing, maybe I'm not getting my medication. Good, very good, good question. We sort all those things out. You're not having a flare up. You're not having a pneumonia. You're not sick from allergies. You're not sick from postnasal drip. You don't have reflux. Reflux is famous for confusing people because the reflux pours over to the lungs and the lungs get irritated and you cough also from the reflux, right? And you have other problems when you sleep at night. Both postnasal drip, reflux, both of them, if you have them, make sure your doctor sort those out. They will also make you cough. Congestive heart failure. There's so many things, which is why I'm saying get that x-ray, see that doctor, and meanwhile, make sure that you're doing your inhaler the way it's supposed to, because if it is cough variant asthma, you've got the right device. Maybe they can switch you over to an inhaler that has a maintenance inhaler that looks like this to reduce the irritation if you're having an irritation, or they can try to make sure that you know how to use this. So this is what I'm going to do. Let's go over this one, which is the Advair generic, which by the way is exactly the same as this one over here. I don't want to confuse you guys, right? These are named the same, and I've done a video probably over in my TikTok more than it is in YouTube, showing you and telling you these are exactly the same medications. Same. Salmeterol, fluticasone, and salmeterol fluticasone, they're the same. But when they change the devices, they throw you guys off and you start thinking, well, I like this one more than I like this one. And I just usually look at you like, they're the same thing. You shouldn't like one or the other, just know how to use them. And both of them happen to be twice a day. These are twice a day, every single day. Whether it rains or shine, that's how we prescribe them. And if you're having a problem with them, you have to check with your doctor. Twice a day, whether you feel good or you feel like your asthma is good or not, you'll be using these maintenance devices twice a day. One of them that I know of is once a day, right? The ones that are like these, this is a once a day. So if you have one of those that is a once a day, you use it once a day. But if you have these that are twice a day, you want to use these twice a day. Otherwise, it's not going to work. So I am just going to tell you right now that when you have this device, you check your number. I don't want this to fall. You check your number. This one says 0 because mine is out, okay? And then you're going to check, of course, make sure it's not expired. obviously you're going to make sure it's not expired. And then for those who are coming midway, you can definitely run through this video. It has got a lot of information. I'm trying to decipher if this lady needs to see her doctor, take care of her postnasal drip, maybe some allergies, maybe she needs an x-ray, or he, I can't remember if it's a lady who asked me that question. And basically do your the routine stuff need to be sorted out. I don't want you to be in a flare and we're discussing how to use this. If you're in a flare, it may be difficult. You may need a deeper treatment. If you're in an attack, obviously this is not the right setup for us. This is when everything is calm and we're talking about maintenance therapy. Okay, so we checked our supply. We are going to use Advia generic, and this is fluticasone, salmeterol. And we are going to take this device and we're going to bring it down, right? We have time. It's not like this one. This one, you got to time everything, right? And if you don't know how to time these, you got to get yourself one of these, okay? Because otherwise you're not going to get the medication in. These only work if they go in the right distribution. They go in, they get delivered, and they get applied down there, and they work like lotion. Consider them as lotion. So if you use lotion once a year, it's not going to work. So you have to apply it maybe once a day or twice a day, right? It won't work. So do not compare lotions to like a pill and IV. They're not going to be equivalent, but these are the ones we use to keep your lungs treated and your rest of your body unaffected, essentially. This is why we use inhalers. But they require time, and you need to be ahead of the time. Not when you get a flare do you start using your inhalers. You need to use them way before, okay? So we brought this down. Now I want to exhale first. Always exhale first. Let's get all the powder on me. Don't do this. Don't do this. It's going to come out. This is why you guys need to understand. If you want these to work for you, you've got to get the technique right. You have to get the schedule right. This is a twice-a-day medication. So once you hold that breath, you exhale, you count to 10 and you exhale, you go rinse your mouth. Why? Because this powder we discussed earlier, this powder can get stuck in the back of your throat. There's powder in this one too. Different than this one, even though some people get irritated with these. You gargle and spit out with water. Why? Because this powder here will get stuck in the back of the throat, and it can cause thrush. It can cause irritation, hoarseness, all these other things. And you're going to say, well, because of that, I'm going to stop. Guess what? Asthma rules and COPD rules, all these other problems that you're talking about. They are more important for you to reduce your chances of going to the ER, going to see your pulmonologist over and over again. We, of course, love that. But I'm just letting you know, if you're trying to figure out how and who is going to help you get rid of those multiple visits, unnecessary visits to your doctors? You're making rounds and rounds and rounds, and you have the same devices, and they keep throwing them back to you. And you say, I know how to use my medication. They will assume you do, because this whole conversation takes too long, and you're going to see less of it, which is why I'm here. You're absolutely not going to see it in the offices. I'm not going to swear, because that's going to be the wrong thing for me to say. Maybe there are some crazy docs out there like myself that are still teaching their patients. Other than that, you're going to really need to go somewhere where people can spend time with you to learn. And I would say that would have to be your duty to do it for yourself. Otherwise, we're going to switch it from this one, and you're going to like the purple one, you're going to switch it to this one, and then you're going to switch it to this one, which, by the way, these two are the same thing. So switching these is just switching the color. You're not switching the medication. This is a twice a day, every single day. This is a twice a day, every single day. This is a twice a day, every single day. There's this one, which is a once a day. So you're going to say, well, I'm going to be on the once a day. Make sure you know what's inside of them. These can vary. It can be Trilogy in here. It can be Brio. They change the colors around, telling us what's inside of them. You who doesn't know it may say, I like Brio and I don't like. There are different medications within devices. Some can have up to 3 different medications inside of them. Therefore, you need to pay attention to the prescription and what your diagnosis is. If you're an asthmatic and somebody told you you're asthmatic, you need to make sure that your doctor has put a little steroid inside one of your devices. Why? Because you need that. You need that to take care of your inflammation. So, my dear person who asked this question, I hope I didn't go too crazy for you. I'm letting you know that the coughing could be, in summary, related to being sick, reflux, postnasal drip, you not using the device, maybe you're coughing it up. Maybe they need to settle you down first with a steroid pill or IV for those moments that we are trying to chill you out, so that we can apply something you can use every single day to maintain you. Maintenance inhaler is key. Look up your maintenance inhaler. And I hope that they're able to sort you out, do a chest x-ray on you, make sure you're good, make sure they evaluate you, that you don't have any other look-alike or sound-alikes like asthma, friends such as congestive heart failure, pneumonia, the other things. And pneumonia is the cousin to asthma because pneumonia is invited by the asthma. So that's why you always get sick, is people who have asthma, they hold a little phlegm. That phlegm is attractive to the bacteria. The bacteria love it. When they come to your lung, if you haven't dried up your asthma, as you should with your maintenance inhaler, on a scheduled basis, you're uncontrolled, right? When you're uncontrolled, you are basically serving a nice landing pad to the infections. And that's why you get sick. And that's why when you get sick, you actually irritate yourself more and you get sicker before you get better. And somebody needs to basically settle you down with some steroids and an antibiotic. And God knows you get really used to the steroids and antibiotic, and you use too much of it, and you keep demanding the steroid and antibiotic. To be honest with you, you're using the steroids and antibiotic over and over again, sometimes basically because you didn't get these. And I want us to start there, that you make sure if this is not working for you, they switch you over to something like this, or they find something that works for you, and they settle your lungs and figure out whether it is truly a technique problem of you using this. Make sure you rinse your mouth after these devices if you don't know which is which, because some of them do cause the powder to stick. Even sometimes when they're in this aerosolized form, it can be irritative to the back of the throat. So you need to rinse, gargle, and spit out right next to your toothbrush. Put all these things right next to your toothbrush. Do your inhalers, brush your teeth, and move on. And do it again at night for majority of these, unless you have these, right? These are the ones today. They're also powder. When you flip them, and you can actually see the powder. So are you supposed to see the powder? No, I'm just telling you that this is powder. You probably have seen it, you've tasted it before. Go ahead and rinse your mouth after the use. Make sure you are pulling this down to your lung so it can sit on your lung. Grab it. That will deposit. Majority, 99% of it will go down, maybe a little bit in the back of the throat, which we're expecting you to rinse. If you don't have a good technique and you go something like this, it will land in your mouth. It's not going to be in your lungs. It's not going to work there. And you're going to have multiple flare-ups and completely confuse yourself. So this is why I'm here. I just want to make sure you guys feel very comfortable with your devices. I am going to end with this particular device setup because I think some of you do need that. It is a spacer. I'm going to show you without what I expect my patients to do. And yes, I usually tell my patients, show me. I do not ask them. I do not tell them. I tell them, show me how you use your device. And then I ask them, which one is your rescue? Which one is your, which is, look at this cute one. Don't fall in love with the colors. Which one is your rescue and which one is your maintenance? So if they confuse these two, I already know they're in trouble. They have no idea. They should know this is the one that they use as an emergency device, quick device for quick relief. This one is a main maintenance. Whether they feel like it every single day, in the morning, at night, in the morning, at night, in the morning, at night. Because if you skip around, you do it in the morning, in the nighttime you don't do it, it goes back to zero. And then in the morning you do it, and then it goes back to zero. What you need is a continual escalation to max. So morning, 10, 20, 30, 40, 50, 60, 70, 80, 90, 100. And then 1 year later, it's still 100. Right? You've got your maximal therapy of this particular inhaler at that dose. So there's a low and high. That way, when your doctor is making adjustments, they're making them for a good reason, meaning your inhalers are not working, the dose isn't right. Not your inhalers are not working, and they didn't even know. You're not even getting it. You're doing something like this. Shake these, and then you prime if it's been sitting for a long time, which would be these. These sit a long time because you're controlled. If you're not controlled, these don't sit. You keep using them over and over and over and over, and you don't know why. You just keep hogging on to them. It shouldn't be like that. If you really are that way, then maybe, yeah, they need to do something else with your regimen. But before they go there, they should check whether you've optimized yourself in your education and the maintenance on the bare minimum medications, the foundations, which I'm discussing here. Okay? So shake it, prime it, shake it again. Always shake it. So priming is testing whether it's going to flow, and shaking these to make sure that this can is going to mix all the medication and flow it out when you press it. Exhale everything out. When you're holding this, make sure my tongue is under this. I leave the airway open so that medication can go down into the lung. I am sucking the air into my lungs and holding it down for 10 seconds. Exhale. Inhale. Okay? Relax. Try to use some of these when they're gone as you practice. You can always learn. This is a spacer. You would shake it, you would put it in here, prime it, whatever you need to do, they always fit, okay? So you just push it in, okay? Doesn't matter the color, it really doesn't matter. Just make sure you rinse, wash these with dishwashing liquid, because we could use those for those type of cleaning. You don't want to use something that's corrosive and that's full of scents. You're already asthmatic or have COPD, you probably don't want anything. You make sure it's hypoallergenic, something that is not going to be irritative. So dishwashing liquid would be best. Maybe unscented would be best, okay? You wash these and you rinse these off if you're going to use these. Don't use them when they're dirty and not good. Air dry them. You can definitely open these. I have lots of videos showing how to wash it. I don't think exactly in YouTube, but definitely on TikTok. I will be doing that little walkthrough about washing your devices. Your nebulizers, your devices all need to be washed. They are going to be contaminated with bugs and bacteria would be the best word, right? Okay. It's going to keep it here so that you can so you're doing shallow. Why? Because this is why, for those people who can't do different technique altogether, these are the sharp big pull with these ones by themselves. But with here, you're already dispensing the medication here and you're allowing it to be missed and through here. These do not have space, of course not, but these do. These type of devices and this type of device can have a space, all right? You see it. You stick it in here in the back. This side has a one-way valve. It only allows you to take things out, but you can't leave it forever. So when you're putting it here, you can use this or you cannot use it. You can put your mouth right here, right? You press it. As you notice, there's no swallowing involved here. So I just want you guys to know, as we do this, as we learn, as we teach, I'm here only to teach. I'm not here to be your doctor. I'm not here to consume your doctor time with questions, right? You just want to make sure you have a good question written out for your doctor. Practice these inhalers. Rinse off your mouth if you don't know when. Make sure you know the difference between a maintenance inhaler versus a rescue or quick reliever, because you do not want to mess it up where you have the right treatment, but you've messed it up because you don't have the right schedule. Once you have the right treatment, right schedule, and things are still kind of loose and you don't know what's happening, that's when the doctor should really evaluate you, make sure that they don't need to upgrade you. You can't upgrade things that you do not know how to take. That's my thing. If you don't know how to take it by technique, you still don't know how to take it. It doesn't matter if you're taking it twice a day. You don't know how to take it. It's just technique needs to come first. And then you need to check that schedule. Put it next to your toothbrush because you should be there twice a day. Do the inhaler, rinse your mouth after, gargle really good, get rid of the residue. Side effects such as heart racing, you go to the doctor, check with them. Why is my heart racing? Don't just stop things. Well, not trying to be an advisor, without realizing that when you stop it, the asthma is not quitting. It's going to be there. It's going to come and get you no matter what. It's going to get you to the ER. It's going to get you to the hospital. It's going to get you with pneumonia. I'm here only dealing with you if you've accepted what you have and you want to deal with trying to limit how much steroids people are throwing at you. These are the devices we're using right now. What about the injections? Oh, yeah, these things exist. Yes, I know some of you guys love the injections. Therefore, we want to make sure that we let you guys know, yes, this one is Nucala, I know. But I tell my patients, people have to know that they have optimized these basic things before we go to injections, right? So that's your schedule and that's your technique. Let's do technique first, schedule next, and then we optimize you by dose and combination. There is combinations, 3, 4, well, there's no 4, but there's definitely 3. You can have 2 inhalers in one, 3 inhalers in one in one. You can have a twice a day inhaler, a once a day inhaler, a 2-puff inhaler, a 1-puff inhaler. Differentiate that. It's not written for fun. It's written for a reason. Scheduled versus as needed. We write as needed, it's as needed. Scheduled is scheduled. When you're sick, different plan. Please don't mix things up and start making them sound and feel like different. Well, this one was once a day, so guess what? I'm going to go this one too. I'm going to switch this one to once a day. You just totally messed yourself up, and it could be very dangerous in the setup that wasn't intentionally meant that way. You may be saving money and then paying at the ER and urgent care. So I'm here. My name is Dr. Mukono, and I hope this particular person who asked this question is going to do well with their doctors and following up and making sure that everything goes well. I wish you all the best. Okay. Okay. So I don't even see how to read my comments because I'm very new. I will try to figure that out at some point. Live chat. Let me see. Oh, wow. I have questions. Let me see. Uh-oh. Don't laugh at me. We're all learning, right? Everybody's learning different things. I'm learning how to sort this out right now. I think I've mastered TikTok somehow, but I do not know how to do this one. Yeah, if you have a lot of mucus, sometimes it's because your asthma isn't taken care of. That's a very good clue that things are not working up. I can't help you with prognosis, but I can help you with understanding what you're supposed to do. Oh, wow. So why doesn't it stay? Hello, hi. People are laughing at me. I actually have a lot of fun doing this because we have to make sure we have fun in life somehow, even in our careers. Find the humor in it, but just make sure you understand that it is a serious problem. Many people have a lot of problems. That's why I exist. And I hopefully will connect with those people who need me and value me and ask me very pleasant questions and understand that they need to use me cautiously and definitely involve those doctors. There's nothing wrong with your doctor. There's just an issue of time. And obviously, they're very unhappy for the most part. Most of them are, including some of them who can't find another way to release that stress, which mine is currently this way. Take care, you guys. I wish you all the best, and I hope you listen to the videos, even if they're very funny and they're cracking you up. Most of the time, the little words I write are usually just to let you know, please pay attention to the very minor details that could actually be affecting you in the long run. We don't want your lungs to scar over. We don't want you to end up on oxygen later. We don't want you to be admitted with pneumonia. All that fun stuff you guys know. Take care.